Postural Orthostatic Tachycardia syndrome, or POTS, is a condition where the body goes into a sympathetic overdrive when standing up. This is Dr. Lam, founder of drlam.com. In this video, we're going to go into much more detail on what the causes of this syndrome are, because it can be very debilitating. The typical symptoms of POTS is a rise in heart rate. It can go up very quickly from a sitting to a standing position from 80 to 120 or even more. And this can cause dizziness as well as lightheadedness, and in some cases fainting. Now, the medical diagnosis is contingent upon what we call a positive tilt table test, where the person is put on a table that tilts. And upon tilting to a certain angle, then it will trigger the heart rate to go up significantly. The problem with a fast heart rate that's over 100, and in the case of POTS, go up to 110, 120, is that the pumping volume of the heart becomes compromised. In other words, when the heart is beating slowly, it has a full volume to go up. But when the heart is beating fast like this, there's just not enough time for the heart to fill up with blood, and therefore the blood going out to the brain and the rest of the body is actually reduced. So POTS is a very serious problem and can be dangerous. Now, what are the reasons for POTS? Sometimes it can be due to a variety of reasons, including in the adrenal fatigue setting, a commonly observed event which is what we call sympathetic overtone. In other words, when the body is in adrenal fatigue state at the last stages, the body is activating the fight or flight response. When this happens, the adrenaline is released from the adrenal glands, and it is this adrenaline that causes the heart rate to go up quickly. Norepinephrine, another hormone as well as a neurotransmitter, also is released from the brain, and that also augments the situation. So when you have these two hormones that is so much responsible for the fight or flight response is flooding the body, then the heart becomes sensitized and it beats faster. It also beats and pound harder. And people would say that, well, they feel their heart pounding. So this is oftentimes a reflection of that hormone. Now, in the case of POTS, where it is a medical condition versus what you experience which in adrenal fatigue, which is symptoms that is similar to POTS, although usually less drastic, much less drastic as a matter of fact, but it's still uncomfortable, and it is oftentimes confused and mistold and misdiagnosed as POTS. The situation clinically that's presented in the adrenal fatigue syndrome is some tachycardia, heart rate going up a bit, but not necessarily to 110 to 120. There may be some lightheadedness or a little bit dizzy, but then that usually resolves if you get up slowly. So this is what we call subclinical POTS, or early undiagnosed and early POTS where the body is not in a full-blown POTS situation. Extensive medical workup also is normal. And usually the sufferer is told to go home saying that they don't have POTS, but they do have POTS-like symptoms. Similarly, another group is that they can be diagnosed with POTS with a positive tilt table test and then put on medications such as beta blockers, but unfortunately the beta blockers sometimes don't work well and in fact can make the sufferer feel even worse. So these are all complications of conventional approach to POTS when there is an associated phenomenon of the adrenal fatigue. So knowing the reason why you have POTS is very, very important, because that dictates whether you want to focus on suppressing the rhythm if it is a structural problem causing POTS because of heart problems, or you just have a sympathetic overtone from adrenal fatigue, in which case you have to focus your attention on the adrenals, and when the adrenals get better, then the POTS symptoms tend to get better. So the approaches are very different. So understanding the symptoms of POTS and how its ramification in the setting of adrenal fatigue is very important. I hope you've enjoyed this video. For more information on this topic, head over to drlam.com, where I have written over 1,000 articles to help educate people. You can also call me at 626-571-1234 for more information on adrenal fatigue and how to navigate it. Finally, if you enjoyed this video, please subscribe to my YouTube channel. Thanks for watching.